So today we're going to lecture on psychotic disorders. Psychotic disorders as a group are profoundly disruptive. They involve cognition, emotion, perception, and a lot of other aspects of the behavior. There's a lot of different causes that are associated with psychotic symptoms, and the expression of them varies across a patient's lifetime, from day to day, across different patients. Everyone expresses these psychotic disorders a little bit differently. So let's first get familiar with some common definitions that are used in describing the different types of psychotic disorders. So first off, thought content versus thought process. Now this is normally in your mental stats exam, but it's something you need to be clear on when you're thinking about the psychotic disorders, because a lot of the psychotic disorders involved thought process, thought disorders. So I like to think of it like this. Thought content is the person's actual thoughts. They can involve suicidal ideation, homicidal ideation, obsessions in a patient who has OCD, delusions, their beliefs if they're religiously preoccupied. These types of things are all going to be their thought content versus the thinking, their thought process, the way that they put their ideas together. A disorder of the thought process would be a deficit in a patient's ability to produce logical and linear communication. What this means is that normally when people are talking, you can follow what they're saying. If you ask them a question, they're going to answer it with a pretty direct, straight answer. That's called linear. When it goes off a little bit in a circle, you may know people who talk like that, just overly detailed. You may ask them what brought them into your office today, and they start back at when they were 10 years old and work their way forward, including every single detail in their life, but they eventually get to the point. This would be called circumstantial type of thinking. Another type of thought disorder would be something called tangential. This is when you're talking to a person, you may ask them a question, and they go off. They veer away from your question, but you're following their train of thought. It's just not related at all to what you asked. But as they're getting to where they're going, the thought actually makes sense. It's just they lost their train of thought. They can't get back to your original question. As opposed to something like loosening of associations, this is where they're definitely not answering your question, and you can't really follow their train of thought. They're just going off, and one thought is connected to another thought very loosely, not in a normal way that you can actually follow. They'll be talking, and you'll think to yourself, I'm not really understanding, this isn't really making sense to me, because it's not, because their thoughts are not really associated that well. Other things that you see in really bad schizophrenia would be things like word salad, where they're just saying words that aren't related at all, clanging, where they're just rhyming things, nonsensical type of speech, neologisms, which are words they've made up. Another definition you need to become familiar with would be disorganized behavior. This is a patient's inability to complete basic tasks that require coordination or manipulation. You might see this more often in patients with catatonic schizophrenia, where they maintain postures, strange postures, for an extended amount of time, or when they have waxy flexibility and you're able to move their limbs in different positions and they'll stay there. Other types of bizarre behaviors would be really cluttered, scattered clothing that isn't really making any sense, or if their house is organized in a way that's very strange. These would all be considered types of disorganized behaviors. Another definition you need to be aware of is that of delusions. Now, I know we've all heard of delusions before, but it's really important to realize that these are fixed, false beliefs. They can't be altered by rational arguments. Or even when you give them proof, that their delusion is absolutely false, they're going to stick to it. They're going to find some sort of way to argue with you, even though you've just told them that what they're thinking is not true. You can bring in birth certificates, you can bring in deeds to the house, you can bring in any type of proof, and they're going to find a way to argue and stick to their belief. And that's the definition of delusions. Also, really important, these beliefs are not shared by the other individuals in their cultural background or religion. So if on your exam it says that a patient's having some sort of strange beliefs, but it's shared by their friends, family, people in their cultural background, then it's not a delusion. It's some sort of cultural belief. Okay? Now, there's a bunch of different types of delusions: persecutory, paranoid, ideas of reference, thought broadcasting, delusions of grandeur, somatic delusions. There's something called Capgras syndrome. This is where a person believes that their family or friends have been replaced by some imposter family. So they'll see their family and they'll recognize their family, but they'll be adamant that that's not their family, that someone has abducted their real family and replaced them with this imposter family. It's kind of a strange delusion.